Let's talk about hidradenitis suppurativa, or HS. If you're familiar with it, you know it can feel just chaotic, right? It's unpredictable, it's painful, and honestly, it can be incredibly isolating. But what if there was a way out of that cycle? A real structured plan to get from that feeling of frustration to a feeling of freedom. Well, that's exactly what we're going to dive into. We're going to break down a whole new way of looking at and managing HS. So here's our roadmap. We'll start with the hidden struggle of HS. Then we'll get right into the 7 big treatment mistakes. After that, we'll talk about a new systemic approach, lay out a super practical 15-day reset plan, and wrap up with what it really means to get your life back. You know, to really get a handle on HS, you have to understand this one thing. It's not just about your skin, not even close. It's a condition that gets tangled up in every part of your life. How you live, how you move, what you feel you can and can't do. It's a life disorder, and it often plays out behind closed doors. And this is what it's all about, isn't it? This quote from a patient really just cuts straight to the heart of it. The goal isn't just about managing symptoms. It's about escaping that awful feeling of just waiting for the next bad day. It's about actually living. That's the hope we're digging into here. I love this way of reframing it. Think of HS as a systemic fire, an issue deep inside your body that's just showing up on the surface, on your skin. That idea changes everything. It tells us we're not dealing with a skin-deep problem, but a much deeper imbalance. And a crucial point, it's not actually a rare disease, it's just rarely recognized, and people can go years without a proper diagnosis. Okay, so if it's a systemic thing, why do so many treatments seem to fail? That brings us to a really critical part of this explainer, the common mistakes people make when trying to manage HS. These are the things that keep people stuck in that frustrating cycle of flares. The source material points to a clear pattern, 7 specific mistakes. Think of these as the common traps that not only slow down recovery, but can sometimes even make things worse. And just knowing what they are is the first step to finally breaking free. Okay, so here they are, the 7 common traps. It all starts with misdiagnosis. The lost years that can cause. Then there's only treating the flares instead of looking at the big picture patterns. A lot of people get the wrong medicine at the wrong time or completely ignore the massive role of gut health. And how often do patients get bad diet advice? Or worse, none at all? Then there's underestimating that powerful link between your mind and inflammation. And it all boils down to this last one. Just living in short-term survival mode with no real long-term plan. Let's really zoom in on 2 of the most critical ones.
So here's a huge takeaway. A flare-up is the end result, not the cause. It's the smoke, not the fire. The argument is that when we only treat the boil or lesion we can see, we're completely missing the invisible cycle of inflammation and metabolic issues that's actually driving the whole thing.
And this one is a total game changer. The gut-skin connection is pretty much everything when it comes to HS. If your digestive system is in chaos, your skin is going to show it. The source is crystal clear on this. Healing your gut isn't just a nice idea, it's a non-negotiable part of the foundation for getting HS under control. So once you see these mistakes, it naturally points to a whole new way of thinking. Instead of chasing symptoms on the surface, we need to turn our focus inward to the entire system. And this is where we start to see a real path forward. This is the million-dollar question, right? After all the frustration, the treatments that don't work, feeling like nobody gets it, what is the one piece of the puzzle that's been missed? And here it is, the answer. The missing link is the ecosystem, your entire body. You see, HS is a systemic inflammatory disorder that just happens to show up on the skin. So when you start treating the whole environment, your gut, your immune system, your metabolism, you're not just putting out fires anymore. You're actually changing the landscape so the fires are less likely to start in the first place. So that brings us to the really practical part, the 15-day reset plan. Now, this isn't a magic cure, but it's designed as a powerful, doable first step to start calming down that systemic fire and to help you feel like you're back in the driver's seat. The reset is built on 4 key pillars. First, you start by removing the stuff that fuels inflammation. Then you add structure, correcting your daily rhythms like sleep and meals, which is huge for your metabolism. Next, you actively bring in anti-inflammatory foods. And finally, you work on calming your mind to break that stress-inflammation cycle. It's a really comprehensive way to get started.
All right, so when we say anti-inflammatory eating, what are we actually talking about? This is a great practical cheat sheet. You want to lean into things like green veggies, lighter grains, think millets, red rice, moong dal, a little bit of turmeric, and always aiming for warm, freshly cooked meals. Now, what do you pull back on? Well, the big ones: sugar, dairy, red meat, and yeah, those fermented and spicy foods can be triggers too. Same with deep fried stuff and alcohol. See, the point isn't about being perfect or following some super strict diet. It's about consistently making choices that help calm your system down.
You know, as we get to the end here, the message gets even bigger. The whole point of this protocol isn't just to heal the skin, it's to heal the person. It's about getting back the confidence and the sense of self that HS can chip away at over time. I mean, this quote just says it all. So many people with a chronic condition feel like they're fighting a war with their own body. The real goal of this kind of systemic approach is to change the internal environment so your body can finally switch from that constant, exhausting survival mode into healing mode. And so, we'll leave you with this thought. What if this journey to manage HS is actually an opportunity? A chance to not just calm your skin, but to build a more aware, more balanced, and stronger life from the inside out? What if this is really about reclaiming your entire life?